Hey everybody, thanks for tuning in today. So we are so lucky to have with us Dr. Leah Gordon to talk about male fertility. So Dr. Leah Gordon is a naturopathic and functional medicine doctor who specializes in root cause women's hormonal health, low libido, preconception, and fertility care. So she's the owner of Womanhood Wellness and Tribe Medicine, and she's a founding medical advisor of Needed, a pregnancy-focused nutrition company, and a passionate speaker and educator. We are so blessed to have her here today. Dr. Leah is also a mama to be after navigating infertility with her husband for almost 7 years. And so she has learned so much, not only from her medical training, her additional training after school, but also from life experience. And I find, guys, that these tend to be the most passionate, educated, up-to-date experts out there. Dr. Leah is committed to guiding, educating, and inspiring women along their womanhood journeys so they can be the best version of themselves. And then they can be a ripple effect of healing throughout their community, right? And same with dads and men. And so you guys know, and any doctors who are tuning in know, if you are a women's health and fertility specialist, you often end up becoming, over the years, a specialist in male fertility as well, because it takes two. So guys, welcome Dr. Leah, and then let us know if you've got questions during the talk. We would love. Hi,
Hello.
how you doing?
I'm good. How are you? Let me get in a
I'm
better lighting position.
You're perfect. I love your background as well.
Oh, thanks. It's the tile in my kitchen.
Great. So thank you so much for joining us. I think so. We were framing this issue a little bit before we hopped on the live, and I want to, for the folks at home, frame the issue before we do a deep dive. So
hmm
for 35% of couples who are struggling with infertility, there is a male factor involved, and in
hmm
10% of infertility, it's a single factor, which is male factor, right? So this is a huge problem that people are looking for answers to fix. And Dr. Leah, you have the answer, so I'm honored that you're here with us. One more fact before we hop in. So
Thank
of,
you.
of these, yeah, of these male fertility factors, 80% of men who struggle with fertility have low sperm concentrations or poor sperm quality. So guys, you're going to hear us talking about sperm and semen analysis a lot today. And this is why, because it's 80% of the reason that men are struggling with fertility. And we're going to teach you the things that you can do to assess and start to fix it. So Dr. Yeah, I'm going to let you guide the conversation, but I want to just start by asking,
Okay.
what are factors involved in male fertility?
Yeah, such a good question. Is my connection okay, or is it kind of spotty?
It's a little spotty. I think
Okay.
here, just cleared up. We're good. Maybe.
Good. So hopefully it will get itself together, but let me know
Okay.
if it's cutting out.
Okay.
Yeah, so there's many factors. Thank you, by the way, for that introduction. I'm super excited to be here. There are so many factors involved in male factor infertility. And so the biggest thing is to figure out your root cause first. And then you can be effective with your treatment, right? So people come to me all the time and say, oh, what do I do for fertility? What do I do for whatever? And it really depends on what your unique issue is. So in the male space, there can be issues with the pituitary and hypothalamic pathways. So that's a part of the brain that releases certain hormones that signal to the testes, for instance, like FSH and LH come from the pituitary gland, and they talk to the testicles to tell them to make sperm or testosterone. So there can be issues along that pathway. There can be issues with the actual testicles themselves. So in the testes, you can have genetic mutations that affect things like Klinefelter syndrome, or if you actually have like damage to the testicles from infections, from past STDs, all sorts of different things can affect the actual testicles. And then you can have obstructive issues that have to do with the tubes that are all involved in male fertility. And so things like the epididymis is what allows sperm to leave the testicles and come out in the ejaculatory ducts. And you can have blockages there. And that one's actually near and dear to my heart because that was the issue with my husband on our infertility journey that we navigated for over 7 years that we didn't realize. He had multiple issues as well, but like a varicocele is a really common obstructive issue. That's when the veins in the testicle area dilate. So if you've ever seen someone with, veins that you can see on the back of their legs that seem like they're really puffy and big, that is a varicose vein, and that can actually happen in the testicular space as well. It creates a lot of heat and stagnation, and that can affect sperm. And so my husband actually had varicoceles on both sides, and he had a cystic fibrosis mutation that affected the epididymis, which is a blockage issue. So that's just like one example of how his root cause was very different than maybe say someone who has prolactinoma, which is a tumor in the pituitary that affects the sperm. And then you can also have immune issues. So sometimes men have autoimmunity to their own sperm, which is a bummer. And then sometimes women actually have antibodies to their partner's sperm. So knowing if there's an immunological perspective. And then we get into the actual sperm themselves. And that really comes from toxins, oxidative stress, which is probably one of the biggest factors in both male factor infertility and subfertility, which is, when people are struggling to get pregnant, but there's not necessarily an obvious, picture, kind of like these physical things I've mentioned, or, there's no genetic issue, there's no physical blockage. And that's where we see issues with a lot of morphology and motility, which we'll get into. But yeah, there's a whole spectrum of issues.
So guys, if you're listening at home, this is why it's so important to go to a doctor to get a physical and to get blood work, right? It's not as simple as, I'm just going to give up smoking and drinking for a couple of months, it'll get better. It's like the problem could be a number of places: your brain, your testicles. It could be in tubes, right, that take sperm from your testicles out. And then it could also be nutritional or genetic. So that fertility doesn't just live one place. So this is why good medicine, including physical exam and workup, is really important. Thank you, Dr. Leah. You did that so well.
Of course.
So we were talking a little bit about interventions. So how do you want to approach this talk? Because there's different interventions depending on where the problem is, right?
Yeah. It's such a good question. So that's where, again, this is like a common theme in my practice. And just when people ask me across the board, what do we do? And it all depends on your root cause. So it really starts with getting a good diagnosis of figuring out what's going on. Like in our journey, it took us almost 7 years. And I actually was the one that found our issue. And I wish I'd had a doctor like me much sooner. And that's not always the case, but you just really want to dig until you understand what's going on. And if someone gives you an answer of like, well, we just don't know, like there's so many other, answers out there. So keep looking, because then once you can be effective, obviously, if it's something genetic, there's not a lot of ways around that. There's things that you can do. Like in our case, there was a genetic mutation with a blockage. We had to do IVF with testicular retrieval to have a baby, which means that they go in and actually take the sperm out of the testicles. That's like an extreme case and not always needed. But, Mike was on all of the best things, doing all the best things lifestyle wise. But if that's your problem, if it's a blockage, you have to get around the blockage. So understanding your root cause. When it comes to the actual sperm quality, no matter what is happening, even in like Mike's case with a blockage, you can still improve the quality of the sperm. So even if you had to go down the route of IVF, the sperm that they extract would be healthier if you take these steps. So this, really, the recommendations I'm going to talk about really apply across the board no matter what, but also important to find the actual root cause of what's going on with you. So the things that we can do outside of genetics and obstructive blockages and things like that are a lot. And the cool thing about male factor infertility is sperm are made every 2 to 3 months. So about every 70 days, they're made fresh, brand new. And that's different than females who have eggs that we're born with. And our eggs do mature each cycle. So we do have influence on the health of the egg to some extent, but we have a lot of influence on the health of sperm as men. And so know that the things that you do and the changes that you make a huge impact, not only on the quality of your sperm, but that is the quality of the DNA that becomes your baby. So these changes that you make early on, I know actually impact the whole health of your child moving forward for like the rest of their life. And that's epigenetics. So if that's something you're interested in learning more about. So when it comes to sperm, the biggest thing is starting with your lifestyle. There are a few key pieces that we know affect sperm. One of those is adiposity, so fat areas around especially the abdomen in men has really been shown to affect fertility. So if you are carrying some extra weight around the middle, you know, the classic beer belly look, it's not going to be good for sperm. So getting on an exercise and dietary routine that helps to, improve that, as well as exercise in general. So testosterone is the main hormone in men that is needed to make sperm. So from the pituitary gland, like I already talked about, there's a hormone called FSH that comes down and it stimulates sperm production as well as testosterone. Having weightlifting or exercise where you're building endurance really improves testosterone, as does sleep. So if you're not sleeping, like a lot of my, I see women mostly, but a lot of them have male partners and they're like staying up late, waking up early, burning the candle at both ends, and that will drop your testosterone, which not only affects the ability to make sperm, but also your sex drive and libido. So if you want to have both optimal, you definitely want to be sleeping at least 7. I mean, find your ideal hours of sleep, but at least 7 hours a night, if not 8 or 9. And stress. So stress is one of the biggest killers for fertility on both partners across the board. And the reason for that is because stress affects all sorts of different hormones that then go and impact fertility. And this is, evolutionarily intelligent because let's say we were back in the day and there was a famine or there was, a war or some really stressful thing, the body doesn't want to reproduce at that time. And so the signal that it's getting is like, let's take a break and not have a baby right now. However, when we live in constant stress in our day-to-day life, obviously that doesn't help. When we do want a child, we aren't necessarily in a famine or a war. We're just in traffic in California, for instance. And so just finding ways to cope and manage your stress is huge. I don't know if you want to say anything about that. I feel like I'm dominating the conversation, but you can pop in whenever.
Perfect. This is perfect. I think it's a good, and guys, you might feel like, oh my God, yet another person telling me to sleep and work out. And like, we will go into the biochemistry of this and talk about specific nutrients. But what I would encourage you to do, if you're someone who thinks you only need 5 or 6 hours of sleep and you're fine, go get some lab work. Look at your testosterone. Is it above 700? If you're under 45, it should be around 700 or above. And if it's not, you need some help and you need to make some changes. The other thing is start to track your sleep. Get a Fitbit, get an Oura Ring, get an Apple Watch. Are you getting 2 hours of deep sleep a night? Because if you're not only is your testosterone going to drop, your brain function is going to go down because you're not doing autophagy. You need to clear out the waste proteins in your brain every night. Your intelligence will go down over time, your memory, your recall, right? Not good. You're not going to repair your tissues. So like even if you are working out in the gym, trying to raise your testosterone, now your muscles aren't repairing. So you're not getting swole, even though you're lifting heavy. So go back and like get the data. If you feel like this is obvious, just because something is simple or you've heard it before, doesn't mean it's not profound and it's not real. So start to track if you need to do that. Yeah. Okay.
Yeah, those are such good tips. I love those. And yeah, sometimes the things that really help us are so obvious and simple that you don't want to do them, but they're what make the biggest impact. So outside of lifestyle pieces, when we get into diet, so it actually has been shown that alcohol isn't great for male fertility. Unfortunately, it's actually more impactful for men than women. So women can drink alcohol more than men can and have less effect on their fertility, even though, I recommend drinking in moderation and all of that for both partners if you're trying to conceive. But if you're the male partner and thinking, oh, I can just like drink 3 or 4 beers every night and I'm totally fine and we can just like have a baby and there's no big deal, that might not be the case in your situation. So taking a look at that. Smoking, obviously. And smoking is because of the oxidative damage that I'm going to get into and talk about, a big piece of that. And then obviously diet. It sounds so cliche and obvious, but eating clean, whole foods, lots of antioxidants, fruits and vegetables, and limiting the packaged, processed, trans fats, inflammatory foods. And the reason for that, now I'm going to get into nutrients, is sperm are little blobs of DNA. And they are the genetic code that codes for your little baby, whether she's going to have, blue eyes or brown hair, or if she's going to, have different predispositions for different things. That's all coded in your tiny little sperm. And they're very fragile. So DNA is very fragile, and it's impacted very much so by the environment that it's bathed in. And so oxidative stress, which is impacts from things like toxins, is one of the biggest issues in fertility. So how we combat that is we have a lot of antioxidants, and we reduce the exposure to these things that cause the damage to DNA. So the things that cause the damage to DNA are things like chemicals in our environment. Cigarettes are one of them, but so are things like plastics, phthalates, things that are found in perfumes and cologne, vinyl that's found in plastic shower curtains or in new building material. So if you're a guy who's a construction worker, or you spray, pesticides or herbicides, or you're a farmer, all of those exposures, you're being exposed to chemicals, the herbicides, pesticides, the fragrances, everything that's in our environment. It's very important to eliminate or reduce as much as possible. And if you want a resource on personal care products, deodorants, all of that kind of stuff, I love the Environmental Working Group, so ewg.org. And you can kind of vet your products and see if they're full of toxic chemicals or not that would be impacting your sperm. And then we want to get into supporting with antioxidants. So we want to eliminate exposure, and then we want to boost up what are called antioxidants. And how they work is basically, imagine oxidants are like little crazy robots that are going around and just like destructing everything, because they have like a loose, screw, and they're just like going all over the place. And antioxidants can donate what's called an electron and calm them down. So they can actually like pacify these like crazy robots that are like destroying your body. That's how I like imagine it in my head. And so we want a lot of antioxidants on board. The biggest ones with men are CoQ10 or ubiquinol, which is the active form. The studies have shown between 200 and 400 milligrams a day of ubiquinol is very, very helpful. If you had to just pick one antioxidant, I would say go with that one because it's well studied and has good support behind it. Other really needed antioxidants are things like zinc, selenium, vitamin E, vitamin A, vitamin C. Basically, all of your vitamin and mineral antioxidants are very important. And zinc in particular is essential for making testosterone. So not only is it an antioxidant, it's also essential to make testosterone, which you need as well to make sperm. There's other antioxidants as well, like the astaxanthins and a lot of the really colorful fruits and vegetables. So anytime you see something vibrant and brightly colored, the blackberries, the blueberries, the orange bell peppers, like anything that's full of color has antioxidants and phytochemicals that are really, really helpful for sperm. And then glutathione. So glutathione is our kind of major antioxidant that replenishes all of the antioxidants that are calming the robots down. And so they need to be replenished. And glutathione's kind of a helper in that. And it also helps with detoxing things out of your liver. So I would say if you had to pick, get on a really good comprehensive supplement that has all of those vitamins and minerals I mentioned, plus CoQ10 or ubiquinol, and potentially glutathione. That's like a really good, base blend to help your sperm no matter what your issue is. And it helps your body in general. And then we get into some other nutrients that have been shown to help with both count, morphology, and motility, and that's something we haven't talked about. And sorry, I'm just kind of going off on this.
This is great. This is great. And I want to take a step back just for 1 minute, guys.
Yeah.
Just to frame, some of you are hearing this term oxidative stress or antioxidants, and I think I didn't really fully understand this before I went to med school. But if you actually see oxidative stress every day when you're walking around in your environment, anytime you see rust. So rust is just oxidative stress that has occurred on a metal. You see it, it's that orange tinge. That is oxidation changing that compound, right? So, and it tends to become more fragile, more brittle. It's not as strong. When something rusts, it's not strong anymore. That same process is happening in your cells. And because the DNA in your sperm are so close to the surface, they're so vulnerable. They're the most vulnerable to that, essentially that rust, right? That's what's happening. So to paint a very powerful visual, like if you're someone who's interested in functional medicine, you've been hearing about leaky gut, and maybe you're like, that's the newest thing. No, that's 20 years ago. Everything we're looking at functional medicine now is cell health, cell membrane health, mitochondrial health, preventing oxidation. So like this is leading edge. And so again, while you're hearing us talk about antioxidants, this might sound like, okay, I've heard this before. It's incredibly important. It's foundational. Like you have to protect all your skin, your hair, your nails, like these tissues that you replace frequently, including sperm, are very vulnerable to oxidative damage. And antioxidants, for the most part, come from plants. Plants have antioxidants to protect themselves when they're growing in an environment where there's oxidative stress outside, just like the oxidative stress that rusts metal, it will affect plants. So plants have evolved to have a ton of antioxidants. So I want to just frame that, like, again, kind of take a minute, and because like you're doing this deep dive and I love it. So let's go, and you were going to talk about sperm and how we can move different markers specifically with sperm morphology and motility. And
Yeah, no, it's so great. I'm so glad you brought that up. So when we talk about, like Dr. Kate mentioned, the integrity of a cell, the sperm is one of the most vulnerable little pieces there. And so we want to support and protect that. When we are looking at seeing, okay, do I even have a problem or not? So if you're a guy and you're like, or a female partner with a male partner and you want to know, doing something like a sperm analysis is very important. So you, like we mentioned, all of the root causes earlier, getting blood work, getting a physical exam, seeing what's really going on. When you want to take a look at the actual sperm itself, you can do what's called a semen analysis. And it's important wherever you choose to do that, that they're looking at a comprehensive profile, not just looking at the count. So count is important. The amount of sperm you have is important. And unfortunately, that number has been going down very rapidly over the last few decades. And they even keep moving the number of normal. So it's not as alarming as it should be how many men do not have enough sperm these days. And so you really want that count to be at least above 15 million. If it's anything below that, then you can have an issue with count. If it's severely low, that could be a sign of a blockage issue or some of these other anatomical issues. If your count is pretty good, the other thing to look at is morphology. This is what the sperm actually look like. So does it have two heads? Are there weird tails? What's actually going on with the integrity of the sperm? If that is a problem, if it's not within normal range, then you know for sure that the DNA is being affected. And that's what we're talking about with this oxidative damage. So that's where you really want to bring the antioxidants on board. And then there's some other nutrients as well. I'll get to that after we talked about motility. So we have count. Semen volume is another thing that they check, but that again could be an indication of a blockage issue. But you have count. You have morphology, what it looks like, and then you have motility, which is how well they swim. So you could have a ton of sperm that look really great, but they're just chilling and not moving, and you're not going to get pregnant. Sperm get to make a very crazy journey up the vaginal canal through lots of different vaginal fluids, up the cervix, up the uterus, around the fallopian tubes, and try to find the egg. And then they get to burrow into the egg. And so the fact that we even become pregnant is like a miracle every time. These little teeny tiny blobs of DNA have to make that journey. And they can't do that if they can't propel themselves forward and are very efficient in that. So that is the forward motility that we're looking for in the semen analysis. Again, if there's an issue with that, a lot of times it comes down to oxidative damage that we want to support. So all of the things we already mentioned have been shown to support these. Some other nutrients that are really key are herbs like ashwagandha. So withania, if you know the Latin term, but ashwagandha is the common name. This one's actually been shown to increase count and morphology and motility. It's a wonderful herb, and I like it around 650 milligrams a day at least. Astragalus is another great herb that has been shown to be supportive. L-carnitine is another nutrient that has been shown to help support semen parameters. Lipoic acid is another one. And then we definitely need our B vitamins like folate, activated folate, and B12 because they actually are involved in making the DNA that are needed for the sperm to be produced. So all of those are key pieces to improving morphology, motility, and count outcomes. And a lot of the other things that we already mentioned have been shown in studies too to improve all of those parameters. So I definitely recommend getting a semen analysis and making sure that it checks all of those markers.
How do you feel about the ones that people can do at home?
So it depends on the type. Some of them are limited in that they only do a count. The one I've been recommending lately is called Legacy, and they're CLIA certified, which is an important part if ever you're looking at a lab company that they've been CLIA certified. And they do all of the 3 markers, and they also offer what's called DNA fragmentation testing. So if you really want to know if the oxidative damage is playing a role, you can actually look and see if the DNA has actually been fragmented or broken apart. And that would be another huge indication that there's an oxidative issue. And so I really like them because you can order them at home. Not all of the at-home tests, I think, are up to snuff or that do a big comprehensive look. There's a few out there, but I do like that one. And then you can also do a sperm analysis with a reproductive urologist. But sometimes it's easier to just do it on your own. It just depends. If you have a great, resource for a reproductive urologist, they'll usually do that test. And the key thing to remember when you're doing a semen analysis is that you want to be abstinent for 3 days before you do it. That means don't have sex for 3 days and then do the test. Because let's say you ejaculated that morning and then you try to do the test in the afternoon, your count's going to be low because you've depleted some reserves. So just make a note of that.
You have a bank account, guys, of sperm, right? So you want that bank account to be full, 3 days full when you go give a sample.
Yeah, exactly. And then sometimes if there is an issue, it could be wise to do a second test, maybe a week or so apart, just to confirm if there's a problem, that there really is a problem. Obviously, if it comes back great, that's probably not a false flag. And so just keep that in mind, that that's something to test as well. And remember, so, I've been down the path of infertility. I help patients with infertility. A lot of doctors, unfortunately, don't recommend semen analyses right away until you've either been trying for over a year and you're technically considered infertile. And if that's the case, I would do it on your own because it's you just waste so much time when you could be changing outcomes in your health and your life. To wait a whole year of not being able to get pregnant and then do a test and then try to make change and then have to wait another 3 months just to see if any change happened, it can get really tedious because when you're dealing with male factor infertility or just fertility in general, it can be a slower process because we have that 3-month kind of sperm production window. So any change you make, you have to wait 3 months to see if those sperm were different. So keep that in mind, that if you have sex tonight, the sperm that you ejaculated was actually made 3 months ago. So if you're making changes this week, thinking, we're going to try to have a baby this week, I'm going to eat healthy and not drink that beer, it's not going to matter for 3 months. So keep that in the back of your mind. It's a very forward-thinking process.
Yeah, very good points, guys. And things like temperature can matter, right, for collecting a semen for an analysis. Your doctor may say to you, look, we can't diagnose you as infertile until you've been trying for a year. Mm-hmm. And even after that, 50% of couples who've been trying for a year unsuccessfully often get pregnant in the second year. And so your doctor, because of standard of care and insurance reimbursement, may not be able to order it for you and have it covered by insurance. Now, that doesn't mean they can't order it for you. Mm-hmm. It just means that your insurance may not pay for it until you're trying for 1 to 2 years. So pay for it. Right? Mm-hmm. When they say no, usually what they mean is insurance won't cover it. So make sure you're asking that question. And then like Dr. Leah is saying, you can do it at home. It's just more information. And guys, when you're looking at your sperm count and morphology and your semen analysis, I want you to remember, and Dr. Leah has said this, but I want to be explicit. We're looking at the health of your own DNA as well. And so if you're low in antioxidants, it doesn't just matter for your sperm, it matters for your heart. Right? Mm-hmm. And so actually catching something like this early and fixing it, maybe you're low in B12 and folate, that's going to affect your cardiac risk in 5 to 10 years, right? In ways that we can go into in another video. But like this is important for your whole person health. It's a great kind of check under the hood thing to do.
Yeah.
And it may alert you to some problems you didn't even know you had.
Yeah, fertility with both couples is a great sign of an issue or optimal health, right? Like fertility, our body's natural state is to be fertile when it's healthy. And so it is a really not like simple, it's not a simple parameter to look at, but it's an important parameter to look at of what is going on with me as a whole person, because it's not like your fertility is just this tiny part of you that's in a box separate from the rest of you, right? If there's an issue there, there's probably issues systemically. And yeah, like you said, it's all preventative for everything across the board. So even if you have a female factor in fertility, you're only going to benefit by seeing what's going on with you as a guy, improving yourself, even if you're not the main issue, you know, it's still going to make your health better and your future baby's health better. And if you as a unit, as a family are healthier, then it makes everybody healthier too. So that's why I love the preconception and fertility space, because I feel like it's such a powerful time when people are motivated to make change, and that impacts like the whole unit.
So I want to talk about that if you don't mind, because Dr. Leah, guys, has created a program for men and women who are trying to conceive. And what I love about this program, and Dr. Leah, I'll have you talk about this in a second, but I want to tell you guys what I love about it so much first. So we're talking about all these nutrients, right? B12, folate, L-carnitine, arginine, selenium, zinc, like they come from food. So yes, you can go out and buy all these supplements, but it's cheaper, easier, and sometimes more fun to get them through food. But if you're feeling overwhelmed, like I don't even know where to start, doctors like Dr. Leah have already created a program for you. It comes with a meal plan. Everybody who comes in my office, like whether it's for fertility or not, you leave with a meal plan that shows you how to get these nutrients. Because, for example, the reason that CoQ10 works for fertility is not because it's a magic pill. It's because you had a CoQ10 deficiency that was in your way of making healthy sperm in the first place. So if you just start to eat more of that nutrient, of course, your body's going to reach a healthier place. And I feel like this is something we need to talk about more in functional medicine, because people often leave talks like this being like, okay, I got to go buy all these pills. It's like, no, this is your birthright to have a diet that includes these nutrients, and then you feel good. And it's no surprise that many people are deficient in these nutrients, because often something like CoQ10 or choline, even, the top food source of that is beef liver. So like if you haven't eaten that ever in your whole life, that's why you don't have enough. That's why you're going to need a supplement. But we can help you figure out other ways to get it. Yeah, Dr. Leah, can you tell us about the program you created for this reason? Yeah.
Yeah, absolutely. So Moon Medicine is the program that I have that teaches you as a woman and or as a man, because you know getting pregnant is a two-person job often, about your cycle, about how you can become pregnant, the windows of which you're most fertile, you know, the different areas that we have to navigate around the hormonal cycle, because men are a big piece of it, and they can kind of have sex whenever, you know, and shoot out their piece of the DNA. And for the female, it needs to be a much more timed, and you need to understand what's going on with your own unique cycle. So there's education there about that, understanding the fertility awareness method. So if you are trying to conceive, but you're not ready yet, you know exactly when to have sex and when not to, so that you can time exactly, like, we don't want to be pregnant right now, but as soon as we do, this is when we're going to, you know, time it. So there's that piece. And then, yeah, I've created a whole food program for 30 days that is all whole food based, anti-inflammatory, and full of lots of the nutrients that we've mentioned, you know, antioxidants, leafy greens that have the folate, anything that's brightly colored, full of not lots of good vitamins. So like animal products that have vitamin A and zinc and all of these other pieces. And then the meal plan is laid out with recipes, breakfast, lunch, dinner, with shopping lists. So you can just take it to the grocery store, or I order stuff on Instacart where I just plug it in to the computer and you just don't have to think about it. I also have, a cooking course that ties along with it that you can get support around. And it follows the 4 different phases of the woman's cycle. So if you are the female, you have 4 different hormonal phases every month. And as the male, you're eating in the same household, you're sharing in that together. And it's a really beautiful time to not only optimize your health and use whole foods to do that, to improve both egg and sperm quality, but also to start doing something together that is with the intention of preparing for your baby.
Yeah, I love that. So where
Yeah.
can people get this?
Yeah, so you can go to my Instagram at Dr. Leah Gordon, and in the link in the bio, you can access it there. Or you can go to my website, tribemedicine.com, and then they can use your code, Dr. Kate, to get a discount. And I also have, if you are interested in additional supplementation, like let's say you don't feel like you can get it, on the link in my bio at Dr. Leah Gordon, I also have my preconception protocols that you can see some of my favorite supplements for that. But yes, food is always first. It's the foundation and where you need to start with everything. And it's key for reducing inflammation and oxidative damage and all of that.
I love that, guys. I don't know if you guys know this, but the number of hours, years of expertise and work that has gone into creating these programs. I was so relieved to see that Dr. Leah created these programs, because now it's a great thing. I can just refer people. She is the expert. She's put in the work. These programs will work for you to change your markers if your issue is with sperm morphology and motility. So you have so many resources. We're here for you. You guys can always contact us, do a free discovery call, go to Dr. Leah's site, check out her programs, use your code Dr. Kate to get a discount on them. But definitely, like, there's hope. That's what I want you to hear if you're listening to this. And it can be easy and fun. So thank you, Dr. Leah, for joining us today. I wanted, yeah, if people see this, because we're going to put this on YouTube too, I want them to know your website right now is www.drleahgordon.com. And people can go there to sort of get started and get connected with everything that you're doing. Before I let you go, we have one question from the audience. Someone who is doing egg retrieval, she wants to know if her partner should not ejaculate for 3 full days.
So it depends. If you have done a semen analysis and he has a lower count, absolutely. If you've done a semen analysis and he has a really high count, like above 25 million, you probably don't need to take the 3-day break. I would say at least 2 days. I wouldn't probably have him ejaculate, the day before. You do a retrieval just to have an increased concentration. You don't want to go longer than 3 days because it's actually better to have that window. You really want it between 2 and 3 days of abstinence. So not having sex for, a week or 2 is not better than actually having sex, 3 to 2 days prior to egg retrieval and or natural conception, whichever route the sperm are needed for. So yes, absolutely being mindful of that is key for boosting up that count and making sure that they have the most optimal nutrients and everything.
This is why you go to Dr. Leah's site, guys. She has answers to questions like this. So she's also got other podcasts where she's talked with people about more in-depth topics linked on her site. So those are free resources for you if you feel like you need more as you're navigating this. So go check out her talks, because it's this kind of stuff that you're not going to get anywhere else, and that you may not have time at the primary care ask these types of questions.
Yeah,
so thanks,
exactly.
Dr. Leah. Yeah, thank you so much for being here.
Oh my gosh, thank you. Thank you so much for having me on. This is such a topic that's near and dear to my heart, and I feel like it's so needed in the world. So thank you for creating the space for it.
Anytime, and we'll do another one of these soon.
I love that. I could do this all day long.
I know.
Okay. Okay, sounds good.
Bye.
Bye.